Hi everyone! So we decided to do our alternative cancer therapy project on mistletoe, aka Viscum album extract. So research shows that mistletoe therapy can be really helpful for a variety of cancers such as breast, ovarian, certain gynecological cancers, non-small cell lung cancer, pancreatic, colorectal, as well as advanced solid tumors. Now, is mistletoe available in the United States? What an interesting question. So, the FDA has actually not approved the use of mistletoe as a cancer treatment. However, you will be able to find doctors in Arizona that will do the mistletoe injections. Won't be available through an IV, but from what we've understood by questioning doctors is that the patient can actually order the mistletoe extract to be administered by a naturopath in Arizona. Now, there are 3 different types of mistletoe that are being used right now. They're from fir, apple tree, and pine. Now, these different types are chosen based off of the type of cancer the patient presents with, as well as their body habitus. So, for example, fir mistletoe is indicated for tumors in the head, neck, and lung region, as well as prostate and leukemias. Apple is more for patients with breast, gynecological, gastrointestinal, and bladder cancers, while pine is more for patients with an athletic build, indicated for tumors of the skin, connective tissue, lymphatic system, as well as kidney, breast, and testicular cancer. Now, mistletoe therapy with Helexer proceeds with 2 different phases, and they differ entirely in their dosages. So the protocol is based on the patient, which of course we love as naturopaths, and factors include the type of cancer that the patient presents with, as well as their body habitus, as we have discussed before. Now, where should you inject the mistletoe? So, injection sites oftentimes show an inflammatory reaction. Therefore, it's really important to alternate where you're administering the mistletoe extract. What they find is that when the inflammatory reaction no longer appears after the injection, that's a really great indicator for that you can go up in dosage. Also, the inflammatory reaction needs to completely disappear before the next injection can be administered. And this is completely regardless of the injection interval recommended for the treatment schedule. Well, what is that schedule? So here's a slide to discuss that. We have, if we're going to do a relapse prevention or palliative therapy, there's going to be a different schedule for that. So for example, during palliative therapy, you can do injections 3 times a week. Once again, you need to make sure that the injection site has completely resolved the inflammatory reaction. And for adjunctive therapy, you can do 3 times a week for 2 years post-therapy, or 2 times a week for 3 years post-surgery. So if you're interested, you can take a deeper look at this slide. Now, how does mistletoe work? Well, there have been a variety of different mechanisms that show its anti-inflammatory and anti-tumor properties. So the anti-inflammatory mechanism, it acts very similar to how NSAIDs work on the body. It inhibits PGE2 via inhibition of COX2. However, there's a lot that we don't quite understand about mistletoe quite yet. There are a few different hypotheses that have been proposed. So many studies show that mistletoe is cytotoxic and can be immune modulating. It can inhibit tumor and endothelial cell growth by delaying the cell cycle progression, causing apoptotic cell death. There's an alternative pathway that can lead to inhibition of vascular formation, leading to starvation of the tumor. Also, it's been found to increase pro-apoptotic activities by activating macrophages in the tumor cells. Okay, and then here's a working theory for the anti-tumor mechanism of action. It's through AXL. So AXL is a receptor tyrosine kinase that's upregulated in expression and activation in a variety of cancers. So mistletoe actually reduces the AXL mRNA and NSCLC cells, which this is really quite profound since oftentimes these types of cancers are unresponsive to certain therapies like cisplatin. So for mistletoe, regarding the therapeutic dose, the safety profile of the herb was found to be completely fine. However, the studies for efficacy show to be semi-inconclusive. Some studies do show that it can be really helpful as a joint therapeutic, while others don't see any improvement whatsoever. Therefore, if you are deciding to use mistletoe as a treatment, we highly suggest you monitor the patient closely. Now, as a group, we recommend this only as an adjunctive therapy. Studies show that it can be really helpful and increase the patient's, overall well-being, increase appetite, decrease nausea, vomiting. However, there's little benefits with pain and diarrhea, but it can overall show a benefit to the patient's overall wellness. Now, we wouldn't recommend this as a first line. It's only recommended as a concurrent treatment. We believe this to be a more beneficial in an integrative cancer plan. So, if you're interested in using mistletoe, these are the references that we chose, and you can take a look, more in-depth look at this information.